Thank you very much for inviting me to this conference. I know you from real life e-health forum. We have gone online this time. So yes, we are going to talk about remote access today, very relevant today. We are going to talk about remote activities, professional and private activities. Because, for example, the internet connection I'm now using is also used by my children who are at university. What are the capabilities of cloud-based technologies from Microsoft in terms of healthcare? I know this title may sound provocative. Okay, who is clicking, me or you? Okay, what is it? Microsoft Cloud, what is it? So Microsoft Cloud for Healthcare, what is it? It's a specialist set of resources provided as a service to deliver results very quickly in terms of healthcare. Well, we want to enable, despite current circumstances, despite the pandemic, is this piece of cake, which is called Care Team Collaborations. I apologize in translated, but I want our medical team to collaborate with each other. We know what hospital reality looks like. Sometimes with the snowfall, medical records are hauled in carts from one ward to another one within one hospital. Or isolation wards, for example, is a challenge. Pose a challenge because a physician from the isolation ward, whenever he or she asks for access to the app, for example, HIS in his room has not access to the system in this ward. So distance, access, these are key issues. And this is not an abstract model because such solutions have been put in place in a specialist hospital in Wrocław, which is a COVID hospital. We implemented them during the first wave of the pandemic, and using very simple remote communication tools such as Teams or remote sharing of desktops, no matter where physicians were, whether they were in their own room or in another ward, they had exactly access to the environment they work every day. AI is used to assist physicians in interpretation of imagining. For example, operational insights are generated using medical records and IMR imagining. So AI has become a hot topic. Last week, together with Professor Aleksandra Przegalińska, we were invited to the radio, and Madam Professor said that deployment of AI in MIR imagining is the most ethical and it's the safest application of AI nowadays, provided that it's up to the physician to make decisions relevant to the patient's safety and therapy, and artificial intelligence is only used to automate certain processes. For example, our partner has put together endoscopic solutions for diagnosing intestine conditions, but it's the physician. This procedure has a duration of 3 hours, so the physician has ample of time to go through the video, which is 3 hours long, but AI selects specific sections of the intestine to take a closer look at possible problem areas. And the third section, which is available as a cloud-based service, is patient involvement. We know that coordinated care, patient alerts, especially when in oncology we are witnessing a slump, an unprecedented slump of participation in screen tests and early detection and early diagnostics. Patient engagement is essential. Patients must take care of their health. They must collaborate with healthcare professionals. In some conditions, looking after the diet, looking after their weight or lifestyle. So cloud-based solutions enable us to put such procedures in place. Another interesting thing, we strongly collaborate with the Ministry of Health. Perhaps you've heard recently what hit the headlines. One of our partners is implementing PulsoCare, a solution for patients, COVID patients who are isolating at home. So it's a pulse oximeter, but remote pulse oximeter. So we can argue whether it's a medicinal product or not. Is it the right care for COVID patients? But we are doing our best, or the Ministry of Health is doing its best to do something to provide the service that is much needed, because there are patients isolating at home and they must be provided with better care than before. Perhaps not perfect care, but their safety has gone up. And development of this platform in a very short stance of time was possible because safety in the cloud is embedded in the cloud. So clouds are compliant with all safety regulations, with all regulations on patient safety, on health data. It's all embedded in the cloud by design. So I wanted to show you what are the outcomes. Ronald Coase described a paradigm that on the mature market where services or products have been standardized, it pays off to buy them on the market instead of building your internal competencies within your organization. So, this translates into a claim that the hospital should focus on its core medical business and outsource many IT services such as platforms or protection measures. I've mentioned Wrocław Hospital, PulsoCare. I have mentioned it a minute ago. It's a great story. I don't want to present it today because I'm in a position to reveal what has been made public by the Ministry of Health, which is the owner of the project. But after the first wave of COVID, we launched the app focused on PPE equipment. Previously, orders for PPE were placed by email, and suddenly it turned out that we used a cloud-based solution, no-code, low-cost. When you click on the right box on the diagram, you can code software, and Minister Cieszyński took him just a fortnight to get a brand new solution and provide pharmacies with PPE equipment. On the bottom, you see a quote of Ronald Coase and Nicholas Carr, who claimed that IT doesn't matter. I know this ambiguous, but technology, that was his point, technology in the 21st century does not matter. if you have an idea, if you have a therapeutic concept, if you know how you want your healthcare institution to work, you can definitely put it in place, because technology is no longer a problem. I do apologize for a minute. I'm at a conference. Okay, that's COVID live. So everything that is happening today requires us to take a whole new approach to IT, to talk with the public at large about how to build this market anew. Well, we know that digitization of healthcare will involve massive amounts of data. There are also massive resources which are archived of service providers, and perhaps in time they will be digitized. We are also struggling with silo structure of data in different healthcare establishments. Well, some systems fail to exchange data, and these are all problems that are related to something that we've called democratization of health. This makes a nod to the triple aim of WHO in healthcare, and WHO's guidelines include improved medicine, improved public health, and that stands for everything that is related to the impact of the environment, including organizational environment, on operations of the healthcare system. And the third factor is lower cost per capita. And I think healthcare costs should be egalitarian, should be affordable alike for city dwellers and for urban and for rural dwellers. Today we can see that infrastructure, which is growing rapidly in the wake of COVID, provides residents of small towns with equal access to healthcare. And they are no longer discriminated compared to people living in the city. So we have established a coalition for telemedicine. You can see this stage. Szymon Chrostowski, CEO of Wygrajmy Zdrowie Foundation, Artur Prusaczek, and remotely we had Radosław Sierpiński, the CEO of Medical Research Agency, and Mr. Maciejczyk from Silesian Oncology Center. So the measure of telemedicine in new times should be cybersecurity and patient security. So that means that it's the man who ultimately decides on the therapy. And Professor Szczeklik and the approach promoted by Hippocrates prove that 60% of the diagnoses are down to the medical interview. So telemedicine can help us as a hybrid solution, because technology, like we've said, is no longer an issue. Okay, we are nearing to an end. And I think, this topic is worth discussing, so you can find me on LinkedIn. Thank you.